Hello, back again. Thank you so much, Ruchika, Lauren, and Sunira, for an amazing discussion. It's time now to jump to our main keynote for the day, the business case for abortion rights, a very important and timely topic for women, trans men, and non binary individuals across the world, but especially in the US right now. Please welcome Nadia Kamis, Director of Corporate Engagement at Planned Parenthood Federation of America.
Hi, Megan. Thanks so much for having me here today, and a huge thank you to Ellevate for our partnership and enabling me to speak to this important topic, the business case for abortion rights, and how reproductive rights are an economic, health, and human rights imperative that are important for all of us to address, and where we all have a stake as employees, as business leaders, as corporate activists and actors, as community and family members. I'm Nadia Hamis. I'm Director of Corporate Engagement at Planned Parenthood Federation of America. And my team and I work with businesses in a variety of ways to expand access to care, advance advocacy for sexual and reproductive health care and sexual education, and to advance reproductive rights, both through campaigns as well as on the electoral level and on the state level across the US. I wanted to first give an overview of what this session is really intended to do, given how many different social, economic, and political issues companies are addressing today. I think abortion rights could not be more timely. When we think about the pending end to our constitutional right to abortion established by Roe v. Wade 49 years ago, and the recent Supreme Court leak that indicated that this constitutional right was likely to end, we know that this affects all of us personally and our companies, of course, as employers, and as actors, both as from an economic standpoint, from a human rights standpoint, and of course from a healthcare standpoint. We know that affordable sexual and reproductive healthcare access is critical to advance gender, race, and economic equity in the workplace, and to ensure all professionals can thrive, not only in the workplace, but in their homes and in their communities. And that affects not just us, but also the next generation. So I wanted to really raise awareness, close maybe the believability gap around the time-sensitive threat to abortion access, talk about how this implicates all of you, and most importantly, how we can take action productively and together as an individual, as a business leader, through your company, and of course through your buying power as consumers and as investors. First, I'm going to set the stage on where we are today, and I wanted to note on a personal level why I came to this work. I grew up in New York City with a New Zealand mother and Algerian father who came from very different families and very different societies in terms of women's ability to access equal rights. I've always been a gender equality champion, starting my career in financial services and socially responsible investing, and then moving to work for the UN and government. And most recently, working in the nonprofit sector over the last 7 years, I have seen the tremendous power of the private sector mobilizing alongside nonprofit and public sector actors in order to really make a difference in regards to advancing equal rights, particularly health and race equity, and of course, gender equality. We know that abortion is essential healthcare, a human right, and an economic issue that all businesses must address if they care about the health, productivity, and sustainability of their workforce. 86% of women state that controlling when and if to have children is critical to their career advantage. And on average, 56% of college-educated women would refrain from applying to a state that has recently banned abortion. And we know that after last month's Supreme Court leak, as I mentioned, it is very likely that our right to abortion established by Roe v. Wade will be taken away, making the first time the court would go back on a constitutional right previously established. And unfortunately, over the last year, abortion rights have been under attack as we've never seen before. We saw in September the introduction of Texas's 6-week abortion ban, and states such as Florida, Idaho, and Missouri severely restricting and penalizing abortion seekers and providers. And most recently, we saw in Oklahoma, a state that banned abortion outright. What does that mean for us? It potentially means that 26 states banning abortion would leave 36 million women of reproductive age unable to access essential health care where they currently live. This is not in favor of public opinion. A recent Gallup poll noted that 80% of the American public believe that a person's right to have an abortion should be held between that person and their doctor. It should not be controlled by politicians nor the courts. And we know that it's critical for all people to have access to abortion. 1 in 4 women of reproductive age in their lifetimes will have abortion, and 59% of those people are already mothers. And so we know that in order to ensure economic, health, and of course, human rights security, as well as the well-being of the next generation, abortion rights are critical. We have so much opportunity together to engage both the public, our fellow business peers, business leaders, and industries to really shape the future of abortion rights today. This can be our legacy as women and gender neutral allies, and as all people who believe that everyone in the workplace should have equal access to healthcare and the ability to operate productively the full capacity of their abilities and without restrictions based on where they live. We also know that reproductive rights and abortion rights are intersectional to LGBTQ rights, to racial justice, the ability of Black, Latinx, and Indigenous women and people of color to participate equally in the workforce, and of course for consumers and community members. I wanted to give you a quick overview of how Planned Parenthood operates in the abortion rights movement and how we work with businesses. Planned Parenthood is the nation's leading provider of sexual and reproductive health care and the leading sexual educator. Our organization for more than 100 years has operated 600 health centers across the US, and we work as a healthcare provider as well as an advocate for reproductive rights and election outcomes that are pro-health, pro-equality. Our health centers see 2.5 million patients per year, and 1 in 5 women of reproductive age visit us in their lifetimes. So we have a good sense of the challenges that many people are already facing in regards to accessing care in states where there are abortion bans. And we are also working with a large number of businesses, from Fortune 500 companies to small businesses, in order to help them assess how they can best plan or address abortion bans and what that means for their workforce, as well as for their values alignment in terms of their investments with their supply chains, in the public markets, with other businesses, as well as, of course, their political giving and lobbying power. We are, Planned Parenthood, the leading abortion provider, but that is actually only 4% of our services. When we talk about family planning and sexual reproductive health care, our services encompass affordable contraception, STI tests, gender-affirming care, cancer screenings and annual pap smear exams, as well as PrEP medication for people living with HIV/AIDS. So alongside our fellow abortion providers, we know that bans on abortion are not only hurting healthcare organizations like ours, but really all healthcare organizations that are at the forefront of providing essential healthcare and critical community resources. We work with businesses in a variety of ways to expand access to care. And we hope that many of you who are not already partners will join us in expanding that capacity. We work on education to mobilize communities and raise awareness of their sexual and reproductive health care access, their rights, and their agency to make a change in regard to electoral outcomes and policies. We do cause marketing when it comes to consumer products, content co-creation with companies, lots of thought leadership and corporate activism campaigns, and more increasingly, as a result of the restrictions that are facing our health centers, core business partnerships where businesses are actually able to help us deliver goods and services and even provide staff resources and expertise to help our providers deliver healthcare, help patients get to where they need to go, and provide opportunities for pilot programs to innovate healthcare, expand telehealth, for example, and teleabortion medication. We also have a robust development program of corporate employee matching gift initiatives and donations. And as I mentioned, our business partners are really helping us deliver care. And that's everything from technology enablement to our digital products support and telehealth expansion to patient logistics, accommodation, healthcare products, loan financing and shareholder activism, and of course, staff time and expertise. And in addition to the work we do one-on-one with companies, we are also part of an organization that is a network of of sexual and reproductive health care actors called Don't Ban Equality. And likely many of you who have participated today, your companies are part of this over 100 company network, which represents more than 110 companies today who have committed to support abortion access and reproductive rights because they know it makes good business sense. I wanted to take a quick second for really to talk about what's at stake for abortion access and reproductive rights today in a bit more depth, and really what the economic case is. Because we know that in moving companies, both as business leaders and also in terms of employees and our ability to have internal activism and engagement, we need data, we need research, and we need trusted historical knowledge to point to. First, I would say that the abortion restrictions already in place are costing us dearly. For the average worker, we have a 9% earnings loss as a result of state abortion bans. And in a year, states are losing $105 billion as a result of abortion restrictions. This is really not smart economics. We also know, as I mentioned before, that 80% of the American public believe that abortion should be legal, particularly since it's a mainstream issue for all of us, with 1 in 4 women having an abortion in their lifetime. And we know today, based on the patient experience of many of our health centers, that abortion bans have been forcing people to travel hundreds and sometimes thousands of miles for care or to remain pregnant, leading to financial loss and healthcare costs and logistical burdens. And so what does this mean? Your talent pool has been deeply impacted, and yet we know there's a war for talent. We know the pay gap is widening as a result of abortion bans, and there's a disproportionate impact on Black women's wages. And we know that widening inequality happens with abortion bans. 5 years after being denied an abortion, women are 4 times more likely to live below the poverty line. So what can you and your company do? I know I'm almost at time, so I first wanted to raise the opportunity for you to look to our Bans Off Our Bodies website, which has a section for business that I'll put in the chat, and you can see our calls to action. First, I would say, as a business leader, abortion is a business imperative now. From C-suite to hourly employees, your team needs the resources to plan for and when they need care. So think about how you can negotiate with your insurance provider, the power you have as a company to negotiate your contracts. Think about your investment power. Think about how investing in a company that is disproportionately backing legislators or directly lobbying legislators and providing them with additional compensation can actually enable abortion bans that are taking place. And then think about what you can do in terms of helping restore abortion access when it's likely that Roe is overturned. How are you thinking about the coverage for your people, for their dependents, when it comes to the impact on childcare and elderly care, as well as on your ability, and most importantly, to recruit and retain talent? And we know that it's really important to remember that abortion bans disproportionately harm Black, Latino, Indigenous, and people of color, and people with low incomes. And that's because of the systemic barriers to care these communities face every day. For employees, you have such power through employee groups in terms of demanding what your companies are doing and asking them to take a position, in terms of the war on talent and your power as an individual, and of course, as your consumer buying power. I know I'm almost at time, but I'd love to have everyone look to also our Don't Ban Equality website, which gives you an opportunity to look at more data and resources and really think about ways that you and your company can take action. And I'll just close by saying that generations before us have fought tirelessly to gain and protect the rights we have today. And without abortion rights, the next generation will have fewer rights unless we mobilize together to ensure all people have access to essential health care in the US. Please contact me and please engage with us. And I'll drop my email in the chat if you'd like to be in touch. Thanks so much again to Ellevate for enabling this important topic to be addressed today. Take care.
Hi, everybody. Thank you so much, Nadia, for all of that information. It is so important to be aware of what's at stake and to use our voice, our power, and our influence to retain our rights. Through prioritizing and initiating conversations like the one we just had, we can share ideas on how to make business more human and how to make the world better for everyone. We're going to be taking a break now, and we invite you again to go back to our expo booths and visit our sponsors to learn about what opportunities they have and receive special offers. We'll also be there to answer any questions about Ellevate, so you can come say hi to us. You'll just click Expo on the left-hand sidebar, and we will see you back here on the main stage for our last 2 sessions of the day, the first of which of those will kick off at 2:45 p.m. Eastern Time.